Hello and welcome everybody. My name is Anthony Brown. I'm the CEO of Health Consumers New South Wales, and welcome to our webinar on artificial intelligence in healthcare and introductions for consumers and community. Before we start today and before I introduce the panelists, I would like to start by acknowledging the many different traditional Aboriginal communities that we're meeting on today from across Australia. I'm on Gadigal land of the beautiful Eora Nation in Sydney, and I'd like to pay my respect to the traditional owners and to elders past, present and emerging. And we respect and acknowledge the ongoing continual connection to land, waters and community. I'd also like to acknowledge and thank the importance of lived and living experience. And we recognise that the lived and living experience of consumers, patients, carers, families and supporters are all important and valuable. People's experience of good health, poor health, disability, using healthcare, treatment and the impact of treatment and recovery is so important. And the voices of lived experience are powerful and needed to make both healthcare and health research better. And we acknowledge, value and thank the contributions that so many people on this call make by sharing their lived experiences and making healthcare and health research better. Thank you for sharing your time and experiences with us all. So the purpose of today is to share with everybody that we've had a lot of requests from our members here at Health Consumers New South Wales around the increasing use of artificial intelligence in healthcare. Some people are involved in projects where AI is being introduced and aren't really sure what their role as a consumer representative, community representative is there. People are being asked to get involved in AI-specific projects. And again, people feel that we need a bit more grounding and understanding about what's happening there. So in response to what people told us, we've got together with our friends from ACHEEV at the University of Wollongong to talk about their work with consumer involvement in AI. And one of the things that surprised and delighted us really was the response to this webinar. This webinar's had the biggest response to any of our webinars in Health Consumers New South Wales history. We have over 300 people registered, and which is so exciting. Many of the people who have registered and many people online today are health staff and clinicians, and we welcome you today to be part of these conversations. But I do want to say that the focus of today's webinar is going to be answering the questions and giving advice to consumer and community representatives who are involved in health services and health research advisory roles. And I also want to let people know that we've received over 250 questions about what does AI in healthcare mean. And so, of course, we're not going to get through all of those questions or provide everybody with a comprehensive understanding of AI in one hour webinar. So this is a planned introduction, and it will be the first in a series of webinars we'll be conducting around the issue of AI in healthcare and in health research. And we'll use those questions that we don't get to today to help inform us about what our future webinars are going to look like. So, and I'd ask people to please use the question and answer function on our webinar today to please put in questions that you'd like answered that come from the speakers, and ask other people to monitor the questions and vote on the questions you'd like to see. Again, we may not be able to get to all of those questions today, but they're going to be incredibly helpful to help us get a better understanding of the information that people want. Before we start, we'd like to just take a quick poll and ask people about what you're hoping to get out of today's webinar and how comfortable people are in feeling that they know where to go to find out more information about AI. And I'll just let the lovely Tara put that poll up. And fantastic. And if people could just let us know how confident you feel about finding information on AI in healthcare, that would be fantastic. And we'll finish up today with a similar poll. Okay. So what I would like to do is just quickly introduce you to our three amazing speakers today. Firstly, Professor Stacy Carter, and I'm really so thrilled that Stacey's able to join us today. I also have to, I suppose, just to declare and let people know that I'm a visiting fellow with Stacey's Centre for the Australian Centre for Health Engagement, Evidence and Values, ACHEEV, at the University of Wollongong. And Health Consumers New South Wales has worked in many different projects and partnerships with ACHEEV over the years. Stacey's training is in public health, and her expertise is in applied ethics and social research methods. Her research programs sit at the intersection of three crucial issues for health systems: using artificial intelligence, screening and diagnosis, and high-quality consumer and community engagement and participation. So welcome, Stacey. We're also really fortunate to be joined by Dr. Yves Saint James Aquino. Yves is a doctor and philosopher of medicine working as a research fellow at ACHEEV. And his research interests include the ethics of artificial intelligence, research ethics, and the ethics of cosmetic surgery. So we're really fortunate to have two really world leaders in the ethics and use of artificial intelligence with us today. And of course, here at Health Consumers New South Wales, as we said at the start, we so much value the voice of lived experience and the voice of consumers. And we're joined by Jen Morris. Jen's a patient safety advocate and healthcare user representative. And Jen's focus has always been on bringing patient and community perspectives to decision-making in healthcare. Jen's areas of interest include gender bias in healthcare delivery, diagnostic error, and how health systems respond to harmed patients and patient harm events. And in 2024, she was inducted into the Victorian Honour Roll for Women for outstanding contribution to patient safety advocacy. So welcome, Jen, and congratulations on that very well-deserved recognition. I'm now going to hand over to Stacey to kick off the discussion and to give us an overview about what AI in healthcare is and the work that Stacey and her team have done in this area. So welcome, Stacey.
Thank you so much, Anthony. And thanks, everyone. Can you see my screen okay?
I can, Stacey.
Yes.
Yes.
Oh, good. Excellent. Thank you. So welcome, everyone. It's wonderful to be here with you today to talk about artificial intelligence, which sometimes at the moment it feels like everyone is talking about all of the time. So it's a very timely conversation for us to be having. I want to start by acknowledging the traditional owners of the land that I'm on today, the Dharrawa speaking people, and to pay my respects to elders past and present. So what I want to do today is to talk mostly about the National Australian Citizens Jury on using AI in healthcare, but what I want to do first is talk a little bit about what AI is. And because everyone's talking about AI so much now, it can feel like it's a brand new thing. Actually, the technology, the computer science technology sitting underneath, it's really quite old. The techniques have been around for decades. But what has changed is that computing power is much is much more powerful. There's a lot more data available, and it's much more possible for the imaginations of mid-20th century computer scientists to actually be realized. So now we're starting to see that work coming to fruition. So it's hard to define AI because it's a lot of different things, but artificial intelligence systems, if we wanted an overall definition, are systems that automate tasks that previously would have required human thinking. And that's things like identifying patterns, predicting outcomes, engaging in conversation, allocating resources, tailoring suggestions, writing text, the kind of things that we used to think only humans could do. AI systems are systems which are able to do those things. So just bear with me for a sec. I'm seeing a slightly confusing view on the screen, so I'm just going to try and sort that out so that I seem less distracted. Okay, so there are lots of different applications of
Sorry,
AI.
Stacey, I'm just going to check whether other people have got
we've got a blank screen now.
Yeah.
Right, but you'll see more in a second. So I'm going to
Okay.
show you a few examples of what AI looks like in a healthcare context, because there's lots of ways that AI is now being applied in healthcare. And these include, for example, algorithms being used in hospitals to predict which patients are most likely to develop a serious infection within the next 24 hours. Systems that have been used by radiation oncologists actually for quite a long time, for more than a decade, to help them plan treatment for radiation oncology patients. The systems that are starting to be used in breast screening services around the world to detect signs of possible breast cancer on mammograms. Systems that can work fairly independently with just a trained technician to identify diabetic retinopathy in people's eyes. The systems that everyone's talking about at the moment, medical scribes, which all sorts of clinicians are increasingly using to summarize recordings of healthcare interactions, to then create case notes to go into the medical record, and potentially also to create summaries for consumers to take with them to take home. And not technically a medical application, but an application that's probably what's got everyone talking so much about AI, the generative AI systems, which actually sit in these medical scribes like ChatGPT, which everyone's talking about. A lot of people, probably many of you, are using at home, and which we know people are starting to use to try to answer health questions as well. There's also AI systems that have been designed for consumers to use to answer health questions. So, for example, systems that can sit in your phone to try to detect skin cancer, or an increasingly popular application of AI is completely autonomous therapy. So psychotherapy using an AI chatbot, or systems that are designed to connect people with cancer to the evidence base and to possible treatment options and clinical trials that they might want to be on, and to help them through their cancer journey in a personalized way. So lots and lots and lots of different applications of these technologies. A critical thing that we'll come back to in the conversation is that sometimes these AI systems can do wonderful things. Sometimes they really have significant problems. And one of the real capabilities of AI is scalability. So unlike a human being that might go a bit wrong, an AI system that has problems can be scaled really rapidly. And so the potential for harm is potentially much greater. But similarly, if an AI system does a great job, it can be scaled rapidly. And so the potential for benefit can also be scalable. Okay, so let's talk a bit about the National Australian Citizens Jury on using AI in healthcare. This was a process that we ran in 2023, and we published it in 2024 in the Medical Journal of Australia. If you wanted to take a picture of that QR code with your phone, that takes you to a website that has more information about the process. So you can see some documentation of the process. You can see some of the expert witnesses and their evidence that was shared with the jury. There's quite a few things there that you can explore at your own leisure if you would like to find out more yourself about the jury. So what is a citizens' jury? Let's just talk about the method for a minute. These processes come from the discipline of politics and government, and they're based on the idea that people should have a say on the policies that affect them, and that people who are going to be affected should have an equal chance to have a say. So these processes randomly invite households in an area that is going to be affected by a policy to participate in a citizens' jury. Then from the people who return an interest in participation, we want to choose a diverse and inclusive group that really represents the diversity of the population that's going to be affected by the policy. And we do that by stratified sampling. So we choose people against demographic criteria to make sure we've got a really diverse group in the room. We create a really clear purpose for the process, something that people can focus on in their deliberations. So we do that by writing a question or a remit that we keep bringing people back to and asking them to answer. It's very important that these processes are well informed. So we provide lots of balanced, high quality information, including by providing access to experts and to resources so that the people that are participating can learn much more than they knew before about the technology. We recognise that it takes time and skills to be able to learn to deliberate. So we give people lots of time, weeks or even months, to engage in these processes, to learn and to talk to one another about what matters to them. And then finally, we want the outcome to really be able to shape policy. So we support the participants to be able to create clear recommendations that can feed into policy processes. So this is a good part of the National Citizens Jury on AI in Healthcare. Not everyone wanted to be photographed. We sent 6,000 invitations all over the country and selected 30 jurors against a whole range of demographic criteria and had a very diverse group in the room. They met with 4 experts. They worked for 2.5 weeks online. They all came to Sydney and worked together for 3 days. And we estimate that each person spent at least 24 hours over the course of that 3 weeks working on the jury process. And together by the end, the group produced 15 recommendations. And I'm going to just take you through them quickly now before we go on to our next speaker. So the first thing that the jury called for was a charter to underpin the use of AI in healthcare. And you can see on the screen the things that they thought that should address. And they wanted it overseen by an independent body with an independent chair and diverse representation. And you'll see throughout the recommendations, the importance of equity and diversity when thinking about AI was really consistent across the recommendations. They called for consistent evaluation to make sure the benefits outweighed the harms of these technologies, and that we think of the benefits of AI as being something that there's a universal right to, so that we don't have a digital divide. We don't have people who get left behind. They called for a guideline for patient rights in relation to AI that's, again, inclusive and not discriminatory. They called for a lot of support for healthcare workers, training, oversight by their professional bodies, lots of monitoring and auditing and reporting of both the upsides and the downsides of AI. They called for really good technical governance, and we know that this is a real issue in regulation in Australia, that a lot of work's going into at the moment. So scrutinising systems for their performance, only approving them if their performance is equal to or better than current practice, and making sure that the data sets that underpin these technologies capture the diversity of our community. Encouraging free and open source software, making sure that the evidence underpinning this technology is of really good quality and is based on trials that include and preference evidence from Australia, local evidence. And finally, that there should be a comprehensive, fully funded community education program that really brings the community along and is part of a broader program of digital health literacy, which I think this event is just one piece of what we need to be doing, which is having a big national conversation about these technologies and how they're used in healthcare. So you will have seen across those recommendations that there was a real concern from the jurors that AI should be used in a way that is safe and effective, but also is equitable and fair. And our next speaker, Yves Saint James Aquino, has spent a lot of time thinking about what does fair and equitable AI look like and what are the potential problems with bias in AI. So I'm going to pass over to Yves now, and he's going to draw out a little bit more why that's such an issue when we think about AI and what it means to think about fairness in the context of AI.
Thank you so much, Stacy. I'm just going to start sharing my slide as well. And hello to all the webinar attendees. I'm so happy to briefly discuss the problem of artificial intelligence bias, which you might also encounter as algorithmic bias. What do we mean by bias? In our study, we found a lot of meanings. There is obviously a very technical and statistical meaning, but the meaning that we are really interested in is the bias that occurs when the outputs of an algorithm benefit or disadvantage certain individuals or groups more than others without a justified reason for such unequal impacts. And bias can disadvantage groups or individuals that are already historically marginalized, underserved, or experience prejudice. These are individuals or groups who identify based on race, gender, presence of disability, or even socioeconomic status. And one of the causes of bias in AI is when an AI system is trained on certain populations but not others. For example, there's an AI system that checks for melanoma or skin cancer based on discoloration on the skin. It was found that the AI system was trained on fairer skin types, and the algorithm or the AI system was great and accurate for those skin types. But it turns out that the algorithm was less accurate for darker skin tones or skin types. So that can happen when an AI system is trained on only on, for example, Americans living in cities, and it's not as accurate when it comes to other individuals who are not the same in terms of social demographics. And the image on the screen is from a paper I wrote for the Australian Journal of General Practice. It shows the three components of a cycle of biases, and which AI or technology bias is only a part of. AI bias can replicate or perpetuate biases that already exist in the world, including clinician bias and social bias. When we talk about clinician bias, these refers to conscious or unconscious patterns of behavior in a clinician that lead to disparities in clinical care. And clinicians are human beings, so they have the biases that all of us have, and that can happen. The problem is when it gets automated and gets unchecked. So that can happen when an AI system replicates or incorporates clinician bias. Outside of the clinic, we also have social bias, and this refers to behaviors or beliefs that treat individuals or groups unequally, often based on unreasonable or unjustified reasons. These kinds of social biases can lead to outright discrimination. That's why you have a lot of groups or individuals that remain to be underserved, at least in the context of healthcare. So for our consumers who are attending this webinar, one of the things that we need to watch out for when encountering an AI system, first, if you have the opportunity, ask the service provider or the developer about the population that the AI system was trained on. Where was it trained? Which groups were included and which groups were excluded? Also ask, if you have the opportunity, whether there's evidence that the AI system works for all groups, most groups, or at least that they do not harm individuals or groups historically marginalized or underserved in healthcare. Again, thank you for this opportunity to talk about bias and provide a very brief background about bias. And I'll now pass on to Ms. Jen Morris to introduce the consumer-led resource on artificial intelligence.
Thank you very much, Yves. And yes, good morning, everybody. My name's Jen, and I'm a consumer representative like some of you. And it's very typical, I guess, that I get asked, you know, how did I end up here? Who am I? Because we all come from diverse backgrounds. So I thought I'd just start with that and then speak about the substance that I'm talking about today. So I've been a consumer rep and patient safety advocate for 16 years now, which feels like a very long time, but also not long at all. I came to this work after surviving multiple near-fatal system failures in healthcare and some frankly appalling experiences in the healthcare system. And at 20 years old, I found myself deeply concerned about the preventable harm being done to patients that I'd seen and experienced, and saying to myself, you know, that's terrible. Somebody should do something about that. And then realizing, well, I am somebody and I can do something about that. So here we are, I guess. I came to be involved in AI work in two ways. First of all, because of my interest in diagnostic error, I was interested in AI's potential to increase or decrease diagnostic error, or perhaps both in different situations. And I've seen since AI causing significant harm as well as preventing significant harm. And my interest has broadened to its role in patient safety and harm more generally. But I also came to it the way I think many of us have, which was not by choice. It just started to pop up all over the place and with increasing frequency, really without me actively pursuing it. And it was a bit of a case of, well, here it comes, ready or not. And I'm sure that's a feeling that will be familiar to many of you here. And it's around about when that was happening that I met Stacy and Yves, who really deserve credit for being several steps ahead of the rest of us in seeing this step change coming before many of us did. I mean, that jury was done years ago now. So they were very much, you know, on board with that. And I think it's important to share that I am of the technology sandwich generation, right? Like I grew up doing school assignments in my own handwriting, on paper, from paper encyclopedias. But I also have a specific memory of the first time that I used Google in later high school. So I'm in that kind of middle zone. And I have absolutely no formal tech background whatsoever. I'm not and never will be an expert in tech or IT. And I was really a blank slate novice when I started exploring this topic properly for the first time. And I really wanted to share that as a way of showing that it's okay to be completely new to this. It's okay to not even know what this really is. And it's okay to never be an expert in it. And that doesn't diminish the role you can play as a rep in applying the values and principles, the knowledge and expertise you do have already around the healthcare system and the consumer experience of it to really what is just a new context and a new challenge. And as consumer reps, it's not our job to be full subject matter experts in everything technical that exists in or interfaces with healthcare. But it can help us to have a baseline understanding of some of those things, to which we can then apply our actual expertise, which is that of the lived experience and community and consumer perspective. So following on from the research project and the jury that Stacey's just described, we spoke about how we might create some direct benefit for consumers and the community in communicating and translating some of the outcomes of that work. And this is a couple of years ago now, and I noted my observation at that time that consumer and community reps were seeing a rapid increase in kind of requests and opportunities and expectations for us to comment on AI in healthcare and contribute to projects in that area. And consumer and community reps, of course, come from all walks of life, and some indeed do have high-level, you know, IT and tech expertise just because they do. However, I noted that many consumer and community reps, myself absolutely included, felt we were out of our depth knowledge-wise in considering some of these issues, and that many of us felt we needed to increase our knowledge and skills in that area to be better equipped to make the most informed and effective contributions on that topic. So Stacey and I, and with Yves as well, decided to put together a written resource that people could use as a starting point in learning about AI in healthcare for their consumer and community rep work. So we committed from the start that it would be a resource created for consumer and community reps by consumer and community reps. And I really want to acknowledge the very sincere and absolute commitment of Yves and Stacey and the team in ceding control of that project into the hands of consumer and community reps, humbly, supportively, and respectfully. And it was a wonderful thing to be a part of. And so, without further ado, today I am very proud to officially launch the resource we created entitled Artificial Intelligence in Healthcare, an Introductory Guide for Consumer and Community Representatives. It's publicly available for free online. The link's been provided to you in email. It will be provided to you again. You're welcome to look at it, share it, go nuts. We want people, we want people to see it. And in doing so, I acknowledge the primary leadership, as I said, of the University of Wollongong team as the initiators and drivers of the start of this project, the Western Australian Health Translation Network for supporting us to embed co-design, and the funding provided by the NHMRC via the research grant to do this work. And I also thank Health Consumers New South Wales very sincerely for their support in allowing us to use this forum today to launch the guide and putting this event together for you and for us. But most of all, I wanted to express my sincere gratitude to the other 11 members of the Artificial Intelligence Consumer Reference Group that was co-chaired by myself and Beck Newen, who's here today, for so generously sharing their expertise during that consumer-led creation of this guide. So present with us today are Beck Newen, Louise Gross, Howard Lance, Olivia Petropoulos, Jessica Wilcox, and Pip Brennan. Also part of the group were Katarina Barajerovic, Gary Cantwell, Karen Hollinson, Kyra Dunning, and Neil Samble, and their collective commitment ensured that a diverse group of consumer and community voices worked together to co-design this guide. I was the lead author just because I happen to be a social communicator and a professional writer by trade, but really the credit should be shared amongst everybody for their detailed and dedicated work on that guide. So the guide is deliberately written to be non-directive. That means we specifically did not want to push a particular view or opinion or conclusion about the subject. Instead, our goal was really just to give consumer reps the background and thought starters that they needed to arrive at their own point of view on the various issues, or decide they're not ready to have a point of view, which is also okay. So the resource really provides 6 main things. It does provide some foundational background information about what AI is and what it isn't, and how it works and how it's created. It gives some examples of how AI is used in healthcare or could be used in healthcare. Ideas about questions to ask to help you understand a particular AI system, like he was just giving some examples of, and being considered about that. An introduction to the kinds of issues and considerations that are relevant to the use of AI in healthcare, which consumer reps might come across or want to raise in the work that they're doing. Some general tips from consumer reps by consumer reps about doing work in this area. Starting list of resources for people who want to learn more, because it can be a big journey if you want it to be, or a smaller one. And the outcomes of the citizens jury that Stacey was just talking about. And I was particularly interested in including the outcomes of the citizens jury, because many of us will have had that experience of being asked to justify the legitimacy of what we do and the work that we're doing, including being asked, what's the evidence and how can you speak for the community when you're just one person? I think many of us have had that experience. And by referring to the citizens jury outcomes, we're looking at a very strong methodology of research, and we're giving consumers easy access to the outcomes of that to help address some of those criticisms by giving consumers solid evidence on which to draw about the views that they're putting forward and the commentary they're giving. So the resource also gives many practical examples of how AI might be used in healthcare. And we really did that on purpose because we wanted to produce examples that were broader than some of the headline and kind of more visible uses that many of us might be familiar with, and look at some of the background ones we don't necessarily see as consumers necessarily. We also tried to draw on examples across multiple settings, not just hospitals, but private clinics, research, allied health, diagnosis, treatment, administration, etc. And while the list is by no means exhaustive, and I wouldn't pretend it was, we hope it gives you a glimpse of the breadth of possible applications. So when we were preparing the guide, we were very aware that some types of considerations around AI, which are really important, of course, such as privacy issues, are better known and probably often more considered and discussed than others. But we also tried to give good coverage not only to those, but also to the lesser known and lesser discussed issues, such as the issue of bias that Eve's just been speaking about. Because we think that, there's a lot going on there and it's easy to focus on one or the other. So we hope you find the resource useful and spread it far and wide, as I said, to support the work of consumer and community reps in this area. For those of you who aren't in that category, but might be healthcare workers or researchers, please take it and share it with the consumers and consumer reps, in your life, and also read it yourselves and get a sense of the work, that people in our part of that puzzle are doing. So it's important in this fast-moving climate with so much at stake, that we empower each other to keep the system focused on and ultimately prioritizing the thing that matters and the thing we're all here for, which is the health, safety, and well-being of healthcare users and the community. And we hope that this guide will be one step in helping us all to do that. So with that, I will hand back to Anthony, because I believe it's question time, Anthony.
Thanks so much, Jen, and thanks, Stacey and Eve as well. I'm seeing lots of claps and lots of love hearts and celebratory icons, thumbs up from people, and a couple of love hearts. So that's fantastic. Thank you all of you so much, not just obviously for what you've done today, but everything that's led to the creation of the guide and the citizen jury that I think so many people are going to find so valuable. And actually, I wanted to start with a question to Jen about what I thought was a really interesting and important insight, in that there's so much happening in AI. It is so complex, and perhaps it isn't our role to be, as consumer representatives, that we don't have to be across everything about AI and know the details. I was just wondering if you could expand on that a little bit and talk about, like, what are some of the things and some examples about conversations where you think our presence is valuable, and what we can actually be saying to health services and people about use of AI. What is the role that we can actually play then if we're not bringing AI expertise to the table?
Sure. Yeah, thank you, Anthony. And I'll address a couple of different parts of your question. So I think the thing that I find helpful to go back to again and again as a consumer rep is that, I've been doing this not since before AI was a thing. It's been a thing for a long time, but since this kind of sudden bump in it, I've been doing this for a lot longer than that. And I think it's important for all of us to remember that the principles and the values, and the things that matter, that we've always talked about equity, about safety, about access, about non-discrimination, about all of those things that have always mattered and always will matter, that this doesn't change that. It's that we have to take those concepts and apply them to this new thing. The way they were once applied newly to EMR, like electronic medical records, the way they were newly applied to different types of treatments as they've come along, individualized therapy, genetic therapy, all those things. And it's important for us to say our job fundamentally hasn't changed, which is giving people access and helping to give people access to safe, equitable, high quality care, and ensuring that community is, priority number one in all the care that we give. So our job hasn't changed. It's just another thing that we're applying it to. But I think, to answer another part of your question, that's the same message that's really helpful to give healthcare services and health professionals. So they've already had existing codes of conduct, regulatory standards they have to meet, and principles about what's supposed to be priority in terms of patient safety and patient-centeredness and non-discrimination and all those things. And I think it's really important to just say to them, actually, all those things apply still to everything you do, including this, and not to actually put it too much in a category all of its own, because that can give people a sense of, it's over there and kind of special, and we can just let it run, on a freight train. And so I find the most helpful thing to do is bring people back to that hasn't changed, your obligations haven't changed, your duty of care hasn't changed, ethics haven't changed, codes of conduct haven't changed. They still apply to this thing, and don't let it become this sort of special bubble that gets its own special rules. It sometimes needs additional rules, but the things that already existed continue to remain in place. And so none of that requires a technical knowledge of, how this code or that code works. It's saying to people, safety still matters, patient-centeredness still matters, anti-discrimination still matters, equity still matters, access still matters, and really just continually anchoring people back into that and actually taking a bit of the hype out of it. It's a big step. I'm not pretending it's not, but that hype is kind of what gets people to forget that long-standing principles still apply to it. So I find that a helpful place to start, Anthony.
Thanks, Jen. I do think that's quite insightful, and I hope that's a helpful insight for people on the call. And just picking up on that point about equity and access, and making sure that we're, creating systems that are helping everyone equally. Eve, we've had a couple of questions from people who've asked about what do we do to make sure that the use of AI is actually isn't going to be disadvantaging certain groups. We've had people ask about people with intellectual disability or living with other types of disability, older people. What are your thoughts about how can we as consumer advocates actually make sure that those really important issues of equity are at the table and being thought about in these conversations?
That's a really important question, Anthony, and there's not a single solution for it. But one I think consumers can really do, as you said, is to advocate for the interest of those people who are not often involved. There's a good trend at the moment of developers already engaging with, for example, healthcare practitioners, but not a lot of developers of AI are engaging with consumers and the need of consumers. So I think that's a space where we can really make a change, because obviously developers don't have the lived experience, so they're not particularly sensitive about these particular issues. But if we have consumer representatives on the table discussing perspectives that they have lived experience on, I think that's really important. The other thing is, if we encounter an AI, especially as a consumer, as I said earlier, let's ask the question, what is the evidence of this AI system working for different groups? Have we validated it? And this is a bit complicated, but because not a lot of AI systems are classified as medical device, which means they are not tested, which means they can enter the market without real evidence of them working on all groups. But if we push for service providers and AI developers to explain the training population, or the population that the AI system was trained on, and any evidence of benefits for specific groups or even harms on specific groups, I think that can go a long way.
That's very helpful. Thanks. Thanks so much, Eve. And something that I think, again, in other contexts, a lot of consumer representatives are often faced by the fact that we're often in rooms where we're the only consumer in the room, or there might be one or two of us. And those questions about how do we ensure, representation and representation of voice when actually the system has set it up in a way that it's limited it to just the two of us. And I think
Yeah,
we're all very used to bringing the conversation back to how do we
the
make sure
consumer.
what we're doing is going to work for the people who aren't in the room. So thank you for reminding us about that. And Stacey, one of the things that came out of the jury, and one of your three sort of key summary points, was about embedding the conversation about the use of AI in a rights sort of framework. And that was really interesting because we have a Charter of Healthcare Rights that talks about so many things, and particularly around information, I suppose, and partnership, where this is where this overlaps. But I'd be interested to hear both what ideas the jury's thought about what that could look like, and your thoughts about what does that mean in terms of turning these findings into something that we can embed in a rights-based discussion.
That's a great question, Anthony. And I think it's a really nice segue from the conversation we just had actually with Eve. So a lot of the conversation about rights was about involvement, actually. So making sure that consumers had agency in the development of AI, in the use of AI, making sure that consumers were actually part of the conversation from the start and not just at the end. And also ensuring that consumers were actually aware of the ways that AI was being used, so that they could, and as Jen was saying earlier, all of the rights that consumers already have in health systems, they don't go away in the context of AI. It's about working out how do they apply in the context of AI. And you can't exert those rights if you're not actually aware that that AI is being used in your care. So even just openness and transparency about the use of AI, openness and transparency about the evidence base sitting underneath that AI, as Yves mentioned. And then I think this issue that we've been talking about a lot around non-discrimination and ensuring equity, I think that also really relates to this question of rights around AI. So making sure that AI isn't only serving a majority population, or it doesn't only work for the very small quorum of people that were in the health data set that was accessible to the developers who created the algorithm in the first place, so that it might work really well for well-off white American men, but not particularly well for anyone else. So I think, just as Jen was saying earlier, the rights around AI pretty much are the same rights that already exist. It's just about bringing them into the context of AI development and AI application and AI governance to make sure that they really do carry through for this technology as well. And I really agree with what Jen was saying before. This is a technological step change, but maintaining that continuity is an important way of pushing back against technological exceptionalism and some kind of idea that we don't want to get left behind. So we just have to apply the technology now, and then we'll kind of sort out the problems later. So a rights framework, I think, is a very helpful way of pushing back against perhaps that desire to have some exceptionalism around the shininess and newness of these technologies.
Again, thank you, Stacey. And I think that's very helpful, because we can all be seduced by the new technologies, and they can do some amazing things. Of course they can, but just to remember that, you know, healthcare at its heart isn't really changing or changed, and that getting back to those basic questions, because we've had a lot of questions, both that are coming through now and that we received beforehand, around people asking about, well, how do I know when AI is being used in my healthcare? And so I think, again, I'd be interested in people's reflections around, we need to get better, and I think we need, as consumer reps, put more, encourage the system to be better at actually telling us about when AI is being used and the potential benefits and risks that are happening there, because I think there's a lot of technology happening behind the scenes that we're just not all aware of. So people have asked some specific questions that we're not going to be able to answer in this webinar, and some that we don't. We'll have to do some research around because we don't know. But I just wonder if people have any thoughts about those ideas, about what are some of the ways we can help get information out to people about where AI is actually being used in healthcare, because as Stacey's introduction showed, AI is this catch-all term for so many different things. And I'm not directing that at any one person, but I'd value anyone's sort of thoughts on that. Yes, Jen.
Thanks, Anthony. Just to the first part of your question about how do we know it's being used, I've discussed with my colleagues here that I've had some widely different spectrum of experiences in that, just as a patient in the last couple of weeks, and some of it has been better practice, which is, you know, very plain language right there in the consent form. Here is the technology I use. Here's a link to read more about it, you know, which is the better end of the spectrum, right down to a different practitioner who had a sign on the reception's desk saying, you know, I'm using this note taker, which Stacey referred to earlier. And if you don't want it used, you're going to have to pay more for your service, which is just totally the opposite end of the ethical spectrum. So the practical answer is, I'm telling people now, assume it's being used until proven otherwise. Not every practitioner is using it, but it's basically worth starting from a default perspective of this GP, this specialist, this whoever might be using it. And then if you want to know, asking the question if you feel comfortable to ask the question. I know that's a power dynamic challenge for people, but read the actual consent form you're signing, check if it's mentioned there, look for signs on the wall, on the desk. I've seen them in different places about that, and or just ask if you feel able to ask. If you don't feel able to ask, get your mate to ring up reception just kind of anonymously and ask the general question about the practice from an individual perspective. But at a group perspective, I think the same thing applies, is that I basically assume now that services, the bigger ones, your hospitals, your ambulance services, kind of at that big level, I assume they're either doing it, dabbling in it, or seriously considering it at this point, because there's very few services that aren't. Starting from that default perspective, and not just taking a black and white idea that all of them are as extreme or as complex, right? Like Google Maps is AI, for example. Lots of us have been using that for a long time, right? Like, and then it's all the way up to this thing's reading my, potential cancer CT and everything in between. And so remembering it follows that spectrum, and that sometimes the staff won't even think of AI as AI if it's down that sort of simpler seeming end of the spectrum. Asking that question, and if you get a yes or a I'm not so sure, more questions like, are you using it for administrative purposes only? Is patient or individual data being put into it? Or is it just like scheduling shifts for staff? Because not all of it is patient related necessarily. They can use it for HR purposes, etc. And if you're getting yes to the higher risk stuff, yes, we're putting patient data in it, yes, we're using it for treatment decision making, that's when maybe you want to ask more questions to figure out the ethics and some of those kind of more complex things that we've been asking. But I'm telling people at this point, assume until proven otherwise, that people are either using it or poking around in it, because that's increasingly a good place to start from.
Well, thanks, Jen. And Jen, that actually reminds me of a discussion you and I had in the lead up to this webinar around that AI has been around for such a long time, and it is embedded in a lot of the systems we use, and sometimes we forget about it. So my question, and this is the final question for this webinar, is what does it mean, and how can consumer representatives actually use AI in our work? Because we all are often invited to meetings at short notice, and we get 50 or 100-page reports that we're expected to read. And when you open a big report on your computer, there's a little link that says, do you want a summary? Do you want an AI summary of this report? And, if we click yes to that, well, we're using AI. And there's lots of other ways. What are your thoughts on that? Can we find ways that AI can actually help us in our roles as consumer representatives? And what are the things we might need to think about?
Yes, so yes, we can is the short answer, but I'll talk about that a little bit more. So there's a very important and legally important, as well as ethically important, distinction I need to draw here, which is that in various roles that some of us are in, there are legally binding confidentiality type or privacy type agreements, right, that we need to be aware of. If you're on certain boards, if you're accessing particular information, and you should know if any of your roles has layers like that. And if that's the case, you should not, and in some legal scholars would argue cannot legally, use any of those summarizing tools without express consent to use that particular tool from whoever owns that confidential, those board papers or those patient harm reports or whatever it might be. So that's up to you in your particular role in your organization. So I won't delve into that deeply, but don't just use them on things that are potentially confidential, commercial in confidence, any of those things you wouldn't just shout out on the train out loud to people. Don't use those systems because you don't always know where the data is going. You don't know if it's going overseas, etc. So that's just kind of caveat one. But if you're summarizing, for example, publicly available documents, news stories, research articles, white papers, government documents that are publicly available, that doesn't apply anymore. You can put that concern aside. But you still have to ask yourself about the limitations of that technology. And an example of that for us, oftentimes a lot of the work consumers do really well is around the nuances of language and the nuances of how things are expressed and how things are categorized and how things are written. And so if you're looking at a summary of papers, you're not necessarily going to be able to give feedback on, the way you've worded that is not very neuroaffirming, or the way you've referred to people with disability here is not appropriate. You start to lose the ability to do that. You may still know about the substance of the paper if the AI is any good, but you lose the nuance. And I think the thing consumer reps do really well is nuance. It's actually one of our strengths, I think, nuance and detail. And you lose nuance and detail when you don't read the reports. It's up to you whether you think that's right in the context of what you're looking at. And I think the other thing, though, is it can be really helpful, Anthony, and I don't want to be down on it. So one example I know a colleague of mine is using, she and I both work on patient safety investigations. So we're sitting in rooms listening to clinicians talk clinician, you know, for an hour. And she will use AI to assist her to decode the acronyms live in the meeting. So she doesn't have to interrupt and be that person who interrupts 27 times in the meeting and then feels weird about that, and, you know, clinicians get irritated. So she'll be sitting there, because they're not big, consequential, life-saving questions to ask ChatGPT, you know, what does this mean in medicine? And it's giving her live, you know, assistance with that. So those kinds of things, decoding technical language, helping to understand what statistics actually mean if you're reading about p-values and blah, blah, and, you know, like asking something, give me a plain language, you know, for blah, blah. I personally choose not to use it for things that I think are significantly consequential, because the accuracy is not high enough for me to feel okay about that. But I'll ask it about acronyms. I'll ask it about what's the evidence for, but I'll always say, give me the link. I want to see myself what the evidence is. So taking you to evidence, summarizing things with some care, helping you decode complexities, plain language, and particularly for people with intellectual disability or English not first language, that plain language description of in your own language is also possible, right? Like super helpful for someone whose first language is not English to ask the tech, please give me in Swedish a summary of this, you know? So it has other applications that aren't personal to me, but that I know other people are using. So it's got two sides to it, but it's about considered and careful use with the big confidentiality caveat over the top of all of it.
Thank you so much, Jen. And thanks again to Jen, Stacey and Yves for your time this morning. I mean, this has been such an amazing conversation, and I know we've only just scratched the surface of so many aspects of AI. People have been asking about, will the links to the various reports and things that people have mentioned be made available? Yes, of course they will. Everyone who's registered will receive an email with a copy of all of those links. And we'll also be putting this webinar up on the Health Consumers New South Wales website, and we encourage people to share this with other consumers and health staff who they think will find it useful. We will have more webinars looking at different aspects of AI based on the questions that people have said. We don't have a schedule of that webinar series yet, but as soon as we do, we'll be letting everybody know. I do want to let people know that by a happy coincidence, our friends at the New South Wales Health Statewide Health Literacy Hub are actually having another webinar tomorrow on AI, and which will include the wonderful Stacy Carter. So we got her first, folks, to talk about this, and that's going to be looking at applying AI to health communication and health literacy, and that's tomorrow on the 8th of July at 12 noon Sydney time. And again, we'll send that link out to people. So it is a hot topic. We're all talking about those different aspects of it. We would also like to ask people to take a couple of minutes just to take another poll. And I'll ask the lovely Tara to please pop that up now. And while people are looking at that, we'd value if people could answer that. That's going to be very helpful. And as I said, we knew that we wouldn't get to everybody's questions, particularly some of those specific questions, but they have been really helpful, and they will help us shape what the next webinar will be, which will be on a topic that's probably much more specific around a particular type of AI or using AI in a particular context. As I said, today's session has been recorded and will be made available to everybody very soon. And again, I'd like to thank our speakers and to thank all of you for giving up an hour of your time to be part of this really important conversation. So thank you all very much. And with that, we'll say goodbye.